Well, veterans, here's how to maximize your health benefits in 2020. I have Ed Sandrick on the phone. He's the director of the veteran channel, Humana Strategic Alliances, and he's been with Humana for 17 years. So he's also the point person for Humana's National Veterinary Service Organization partners, the Veterans of Foreign Wars, VFW, and the American Veterans, AMVETS. Welcome, Ed. Good to have you again.
Thank you for having me. I appreciate it.
All right, well, it's a busy time, so we're saying that, look, if you're a veteran considering Medicare options in 2020, you will have the opportunity to maximize your coverage by electing to have a Medicare Advantage plan that complements coverage that you may have through your Veterans Affairs benefits. But it is important veterans understand how a Medicare Advantage plan can round out the coverage provided by VA benefits to maximize health and wellness benefits. That's about it, Ed, isn't it?
That's about it. You said it all. Our Humana Honor Medicare Advantage plan was created with those veterans in mind who use the VA and get much of their health care through the VA. But we also noted in that there were some benefits like dental and access to urgent care that would be, as you mentioned, rounding out and complementing the services that they get through the VA. So the Humana Honor Medicare Advantage plan was created with veterans in mind. It's available to anybody who is eligible for Medicare, not just veterans, but it was created, again, with the veterans in mind who use the VA.
Right. Well, from what I'm to understand, Ed, these plans, which are open to everyone with Medicare, they're going to reinforce the ongoing commitment to support the total care our veterans need. And this means, in and out of the doctor's office.
Exactly. It's a plan, the Medicare Advantage plan, the Humana Honor Medicare Advantage plan was created to work side by side and complement the care that the veterans get through the VA. So, as I mentioned, they work side by side. They don't interrupt one another. The VA benefits nor the Medicare Advantage plan. A veteran can go to his or her provider at the VA, certainly get their prescription drugs at the VA, but they also could go to a provider in the Humana Honor Medicare Advantage network and get services there.
So let me ask you this. Do you believe that Medicare Advantage and VA benefits do work together?
They work in tandem. They work side by side. So I would say that it's important to note that there are two different programs, two different government programs. So they don't interact with one another. They don't communicate in any way with one another. A veteran can go to the VA, get his or her health care there, or they can go to a civilian doctor in the Medicare Advantage network and get the health care there. So to say that they work together is not exactly right. They work side by side.
Side by
side. No harm, no foul.
No, okay. And are there any specific Medicare Advantage plans that are designed with veterans in mind?
Well, again, the Humana Honor Medicare Advantage plan was designed just that way. We looked at what the veterans were getting at the VA and saw an opportunity to complement the care that they get at the VA. So the Humana Honor Medicare Advantage plan was created with those individuals in mind. No, I need to note that Humana Honor plan is available to anybody eligible for Medicare, but to your point, it was designed with veterans in mind.
And, of course, all this information now, not that I'm finished with you yet, but I just want to get this out early. There's a couple of ways for people to follow up on this now. First of all, the website. Yep. What's the website again?
Sure. So generally speaking, anybody can go to Medicare.gov and see all of the Medicare plans that are available, what Medicare is all about, as well as get access to what Medicare Advantage plans are offered by many companies across the country, including Humana. They can also go to humana.com/Medicare, where they can see the Humana plans, including the Humana Honor plan, and see what plans are available in your specific area through Humana. Mm-hmm. They can talk with a licensed agent by going through that Humana website. The number would be 800-457-4508. And I think I'd recommend that. I would recommend that. It's always good to talk to somebody who understands all of the options that are out there, and they can talk with, the individual as to what their financial situation is and what their health needs are, whether or not those specific drugs are on the formulary, those kind of things. So you get very specific, and everybody's case is different.
Yeah, well, that is true. Everybody's case is different. And there's nothing better than speaking with somebody human, is there? I tell you what, these machines. So let's be real clear on this, Ed. If you're a veteran considering Medicare options in 220, you will have the opportunity to maximize your coverage by electing to have a Medicare Advantage plan that complements coverage that you may have through your Veterans Affairs benefits. I mean, I think it's important for vets to understand that, isn't it?
It absolutely is. And once again, just to make sure that they understand what Medicare Advantage plans are available in their specific area, they should go to Medicare.gov to see all the plans that are available in their respective geographies, or Humana.com/Medicare to see the Humana plans that are out there.
Mm-hmm. Okay. So the launch of the Humana Medicare Advantage Honor plans, a natural next step, really, isn't it, in the commitment to veterans? It is important to understand that a veteran's health goes beyond physical symptoms. I mean, it's a state of general well-being that encompasses a healthy body and mind. Now that they're open to everybody, I think that's right too, Ed.
That's a great point. And Humana is a company, as you mentioned. I have been with the company for 17 years, and we've had a commitment to helping veterans in the military and their families for a long time. Mm-hmm. We've been a TRICARE administrator since 1996, and recently we were awarded the TRICARE East contract, under which we cover almost 6 million military active and reserve servicemen and women and their families. As you mentioned earlier, we've had the relationship with the VFW and AMVETS since 2012. Both of those have been outstanding relationships and doing what we can, leveraging our respective strengths to help veterans and their families out there. Humana put a stake in the ground and said we're going to respond to the underemployment or the employment crisis among veterans and spouses back in 2011, where we said we would hire 1,000 veterans or spouses. Since that time, we've hired almost 5,000.
Mm. Yeah,
and recently, pardon me.
That's all right.
Recently, we've been working with the VFW, the Veterans of Foreign War Service Officers, to connect with them. They're the individuals who advise veterans and family members of veterans as to what their benefits are. So we're working with the VFW and the service officers to make sure that our agents across the country have a good understanding of the VA benefits that are available, as well as the service officers having an understanding of what Medicare is all about.
Yeah.
Because both of our organizations talk with the same clientele.
Yeah, well, you do a great job. I mean, you lead a team that's focused on developing and implementing veteran outreach activities at the state and local level, primarily with Humana's retail organization. I think you began your career at Rush University Medical Center in Chicago, didn't you, after your master's degree that you achieved in health systems management for Rush University. You've held a variety of senior management positions in both hospital administration and managed care. And, of course, an active duty. Sometimes people want to know, well, you know, my word, an infantry officer in the United States Marine Corps from 1970 to 79. And then you retired from the Marine Corps Reserves in 2000, attaining the rank of colonel. So you've been a busy boy, haven't you?
It's been a great life. I've enjoyed the run that I've had, both as a Marine, as a hospital administrator, and certainly enjoy working here at Humana.
That's great, mate. Well, you know both sides of the field. I mean, that's what's important, and great job for the vets. All righty. Is there anything else you'd like to add, Ed? Anything else of importance?
Always important to end with the important numbers, and that is October 15th to December 7th is the open enrollment period, so people still have time to look at their options until December 7th. Once they select that option, it's the option they'll have for the entire year next year. Mm-hmm. So for information, Medicare.gov has a wealth of information, and Humana.com/Medicare is where they can get access to the plans that Humana has available. And by dialing 800-457-4708, they can talk with a licensed agent.
All righty. Well, Let's hope everybody gets onto it. Thanks, Ed, for your time again. Appreciate it very much.
Thank you very much.
All right, you've got it.